welcome to my vlog. Hello guys, good day, I'm back. So I hope you have a good day. I hope you had a good day, and I hope we were able to do the things that you need to do for a good day. Alright, so today I'm going to discuss something, and I'm going to vlog about the very controversial coronavirus. Alright, so before I'll say something about the updates, I know that you've been updating yourselves every day. I just would like to share my thoughts and ideas about this virus and how dangerous it is. And of course, some statistics that could also let us be updated, all right, regarding this virus, regarding the disease. All right, so let's get to know what is coronavirus first. So coronaviruses, or COV, are a large family of viruses that cause illness, all right, ranging from cold to more severe diseases. All right, so it is also related to Middle East respiratory disease, or MERS, and also SARS, or severe acute respiratory syndrome. All right, so as what it is identified or researched by the World Health Organization, it is really a dangerous kind of virus, and as of now we don't have vaccines for it yet. All right guys, so as what I researched, this kind of virus is really dangerous. So it's airborne, and it could also be through droplets. All right, so better be safe, and later I will also give you or say to you all the factors that we must do, all right, all the preventions that we must do to, of course, not have this disease. Of course, we can't prevent anything around us, we can't stop it. The only thing that we could control is ourselves, and how are we able to prevent this disease that could enter in our body. All right, so for now I was able to research something about the statistics, all right, geographical distribution of coronavirus worldwide. All right, so specifically, it happened first in China, right? And as we all know, China is located in Asia, so most Asian countries are affected in this, especially those countries that are near China. All right, so we have the first one, of course, China. In China, we have 77,749 cases. All right, I'm gonna put it in my description, guys, so don't worry about it. And the next one is we have Korea. Korea have but by the way, I would like to say something about the confirmed cases and the deaths. All right, so I'm going to repeat it. China has 77,749 cases and 2,665 deaths. Republic of Korea, they have 893 cases and 1 death. So as of February 25, 2020, all right, that is today, we have 8 deaths from Korea. Okay, and third in the list is Japan. All right, Japan has 144 confirmed cases and 1 death. All right, top 4, it's Singapore. It has around 90 confirmed cases and 0 deaths. All right, 0 death, I mean. Okay, so it's the top 4. So we have China, Korea, Japan, Singapore, and the 5th one among the top 5 is Iran. So Iran, it says here, have 61 confirmed cases and 12 deaths. So Iran has 12 deaths as of February 25, 2020, updated cases. All right, so we have China, Korea, Japan, Singapore, and Iran for the top 5. Okay, so again, guys, this is updated. So if you really want to research it, just search it in Google, and you can find ecdc.europa.eu. So I searched it there, and of course with World Health Organization website. Okay, so the top 6, it's Thailand. It has 37 confirmed cases but 0 deaths. Okay, again, Thailand is the 6th, 37th confirmed cases, 37 confirmed cases and 0 deaths. Next is Taiwan, the 7th. Taiwan has 30 cases, confirmed cases, and 1 death. All right, so there was 1 who died in Taiwan. And next is Malaysia. All right, the top 9, 22 confirmed cases and 0 deaths. And 10th is Vietnam. Vietnam has 16 confirmed cases and 0 deaths. All right, guys, back on the statistics. We have top 1, China, top 2, Korea, top 3, Japan, top 4, Singapore, top 5, Iran, top 6, Thailand, top 7, Taiwan, top 8, Malaysia, top 9, Vietnam, and top 10 is United Arab Emirates. Okay, so United Arab Emirates, or UAE, had 16 confirmed cases and 0 deaths. All right, so I'll just focus on the top 10. And after preceding United Arab Emirates, we have Kuwait, all right, Philippines, India, Bahrain, Oman, Israel, Afghanistan, Iraq, Cambodia, Lebanon, Sri Lanka, and Nepal. All right, don't worry, guys. I'm gonna put all the description and the confirmed cases, all right, in the notes down there. All right, so yes, it's the updated case, and most of us are already aware of it. All right, everybody who's watching right now, we need to be safe. Of course, we need to take care of our family, of our health specifically. All right, we need to observe proper preventive measures in order for us to continue having good health. All right, we need to prioritize our health, not just because of this case, because of this controversial virus disease, but because in their everyday lives, we really need to take care of ourselves and be healthy. Our optimum way is to be healthy. All right, we need to take care of ourselves. So after this statistics, I would like to say something about the preventive measures of this disease. All right, so I think you already know this because you've been watching a lot of videos about coronavirus and the prevention, but of course I would like to make my own. All right, so if you have time, and if you can watch my vlog, if you were able to watch my vlog, then I think you've heard this many times. All right, so this is also for my personal notes. All right, just in case I forgot something, or just in case I would like to remind myself, I would like to watch this. All right, so the first one is, of course, the basic measures are to prevent, number 1, to prevent the coronavirus. All right, to prevent the virus that would enter in our body. Of course, in what way? It's to wash your hands regularly. All right, don't touch anything in your body if you're outside. Don't touch your nose, don't touch your eyes, your mouth, especially if you're in the public area, in a train, in a taxi, all right, in the car, in the mall, everywhere, outside your house. If you're not sure what you're holding, all right, or who are you touching, please always wash your hands. We have toilets everywhere. We have comfort rooms, bathroom. It's just the same. All right, so we have faucets there. We have sink. Please do wash your hands. All right, wash your hands regularly. Why? Because this is the only way to prevent the virus that would enter in your body, specifically in your hands. All right, so we need to use good soap, of course, with water, and alcohol-based hand sanitizers. Okay, it's very important. And of course, if you're number 2, if you're talking to anyone outside your house, please maintain social distancing. All right, maintain social distancing. It's not too near to someone that you're talking to. All right, keep distance, because you don't know when you talk to them, they might suddenly cough, or they might suddenly cough. That's the number 1 thing. So you need to keep distance and check. Of course, you will see that you don't need to become a professional, or you don't need to become a medical professional or a nurse or doctor to see them, but of course, as a normal person, you will know if the person is healthy or not, or if the person is sick or not. All right, so better be observant. And of course, number two, maintain social distancing. All right. Next, it's also correlating to washing your hands. If you can't wash your hands, just please don't touch your eyes, your nose, and your mouth. Okay, viruses, that is the portal of viruses. That's where they enter. All right, so better wash your if you cannot wash your hands, or if you don't have enough time to go to the toilet or the bathroom, please do avoid touching your eyes, your nose, and your mouth. Even if you wear mask, don't touch it. All right, because there are also masks that are not 100% safe. All right, like for example, if you're wearing, I'm not really familiar with all kinds of masks, but like we have N95 mask, we have surgical mask, we have different kinds of mask, but better wear surgical mask. Because if you're just wearing any mask that you just bought somewhere, cheaper mask, or you don't know if that's a surgical mask, it's not safe. All right, better wear surgical masks, because those are recommended by health professionals like doctors, all right, nurses, like that. Of course, practice number four, practice respiratory hygiene. Okay, so why do we need to practice respiratory hygiene? Like for example, if you cough, if you sneeze, or if you cough, it's by the World Health Organization, guys, so I've learned it from the WHO. You don't use this one, but use your elbow when you cough or sneeze, like like that. Use your elbow, and yes, it's much better to use that part of your body. All right, and it's easier to access, of course. All right, and respiratory hygiene is very, very important. Clean yourself, of course, most especially. Maintain not just respiratory, but your body. Okay, so learn to observe proper respiratory hygiene. And if you have fever, cough, and difficulty of breathing, seek medical care. Okay, if you can't take it anymore, or let's say for example you're so busy at work, you don't have enough time to rest. If you don't have enough time to rest, really you are so prone of having the virus, because you can easily get infected. Okay, because you don't have enough rest, you're stressed and you don't have enough rest. So your body don't have enough antioxidants, or especially if you don't take a lot of fruits and vegetables or healthy foods, so you don't have enough antioxidants in your body, so you can easily get the virus or the infection. All right, so I'm trying to make this easier to understand, and I just use more layman's term words, or like easy words for you to understand, because if I use medical words, maybe it's you cannot really easily understand it. So yeah, that's the only way. Of course, wash your hands, seek medical advice if you can't really take it anymore, but prevention is better than cure, guys. If you can of course, to wash your hands, just better stay at home, don't go out, especially if it's so rampant in your place, like if you're located in those places that have higher cases of COV and COV. Okay, please stay at home, and of course keep safe by just eating healthy foods, observe proper respiratory hygiene, and of course wash your hands, and of course use alcohol and hand sanitizers. Alcohols must be 70% isopropyl alcohol. Those alcohols can prevent any viruses, all right, in your hands. All right, I think that's the only thing that I could give you, because I'm not really like 100% good in explaining about coronavirus. I've just searched this, and of course this video is to help you. Of course, if you don't have enough knowledge, or if you don't have enough guidance about this kind of disease. So it's just about the updates and the preventions, and of course my idea about it is that in our daily lives we encounter uncontrollable situations, and this kind of situation is happening right now. You know, we didn't expect this. It just happened suddenly, and it affected a lot of people, not just hundreds but thousands of people. And if we don't try to take care of ourselves, if we don't try to observe those proper safety measures, preventive measures, then we will be really prone to have that kind of disease, or the virus would really enter in our body, and we don't want that to happen. We don't want that to happen to our loved ones, to our family. So better prevent it, or else you don't really have a choice but to go to the hospital and of course treat yourselves. And if you are a person who doesn't want to spend a lot of money, all right, or if you try to save a lot of money these days, of course, don't go to the hospital. And the only way that you cannot go to the hospital is that if you prevent yourselves from any diseases or viruses that could enter in your body. All right. So better be safe, and yes, take care of your loved ones. All right, that's just my piece of advice and my updates. All right, for my vlog here, guys. Communities, thank you so much for watching, and I hope you enjoyed, and I hope you learned something. That's the most important thing. Learn a lot, and of course, educate yourself. All right, not just because you're watching this, but even if you're not watching my vlog, better educate yourselves, especially in this kind of virus or disease. Thank you so much for watching, and I'll see you on my next vlog updates. And please don't forget to click subscribe and like my channel, my health channel. Thank you so much once again, guys. I'm your entrepreneur's Kimmy, and please keep yourself updated for more vlogs that is coming here. Thank you so much, and good day. Bye.